What diverticulitis infections cause sepsis? Imagine a small pouch in your colon wall called a diverticulum. When it gets infected or inflamed, that's diverticulitis. Now, if that infection stays contained, you might just feel some pain or discomfort. But sometimes, things get serious. If the infection spreads beyond the local area, it can lead to a condition called sepsis. Sepsis happens when bacteria from the infected diverticula escape into the bloodstream, causing widespread inflammation and potentially life-threatening complications. The bacteria involved are usually part of the normal gut flora, including bacteria like Escherichia coli and other members of the Enterobacteriaceae family. These bacteria normally live harmlessly in your colon, but when a diverticulum becomes blocked, often by stool, it creates a perfect environment for bacteria to multiply rapidly. This leads to inflammation and infection inside the diverticulum. If the infection is mild, it might stay localized, causing symptoms like pain, fever, and chills. But if it worsens, it can cause the diverticulum to rupture, releasing bacteria and toxins into the abdominal cavity or bloodstream. When bacteria enter the bloodstream, they can cause a systemic response called sepsis. This is a serious condition that can lead to organ failure if not treated quickly. Sepsis is more likely when diverticulitis becomes complicated, such as when an abscess forms or the colon wall perforates. Perforation allows bacteria to spread freely into the abdominal cavity, causing peritonitis, which is inflammation of the lining of the abdomen. This widespread infection can then enter the blood, triggering sepsis. Certain factors increase the risk of developing infections that can lead to sepsis. Older adults, people who are obese, smokers, and those taking medications like steroids, opioids, or non-steroidal anti-inflammatory drugs are more vulnerable. A diet low in fiber may also play a role, as it can impair gut health and immune response. The key point is that when diverticulitis progresses to involve abscesses, perforations, or peritonitis, the bacteria can escape and cause sepsis. Recognizing the signs of sepsis is crucial. Symptoms include high fever, chills, rapid heartbeat, confusion, and severe abdominal pain. If you experience these symptoms, especially with known diverticulitis, seeking immediate medical care is vital. Treatment typically involves antibiotics to fight the infection, drainage of abscesses if needed, and sometimes surgery to remove damaged parts of the colon. Early intervention can prevent the progression to sepsis, which is associated with high risks of organ failure and death. In summary, diverticulitis infections that cause sepsis are those where bacteria from the colon invade beyond the local site, leading to abscess formation, perforation, or peritonitis. These complications allow bacteria and their toxins to enter the bloodstream, triggering a systemic inflammatory response. Prompt diagnosis and treatment are essential to prevent serious outcomes. If you have diverticulitis, be aware of symptoms like fever, chills, and severe abdominal pain, and seek medical help immediately to reduce the risk of sepsis. Always consult healthcare professionals for personalized advice and management.